Hello, and thank you for taking the time to watch this video and giving me the opportunity to share with you information about a new diagnostic test for chronic kidney disease, or CKD, that's just been introduced into the UK from the United States. Since qualifying as a vet in 1919, I have been extremely frustrated by our lack of ability as a profession to diagnose kidney problems early on in the course of the disease. So as far as I'm concerned, what I'm about to say in this short video is therefore very exciting. I'm going to explain why I personally think that this test has so much to offer cat owners like yourselves, because it has the capability of revolutionising our ability to diagnose kidney disease much earlier on in the course of the disease's progression, thereby enabling us to manage the problem so much more effectively. So in this video, I'll mention briefly the function of the kidneys. I'll then cover the frequency of CKD, the issues associated with old traditional tests, and how the new test overcome these problems and how it benefits you and your cat. And I'll end by talking about how we manage the problem of CKD. So this slide illustrates the major functions of the kidneys. Firstly, they excrete waste or toxic products from the body, which have been produced by the metabolism of proteins. So when the kidneys fail, these toxic products tend to accumulate in the body. Secondly, they are responsible for the maintenance of water and electrolyte balance. So this effectively maintains our hydration status and keeps our salts such as sodium, potassium, calcium and phosphate levels correct. Cats with kidney failure will often have too low levels of potassium, which can make their muscles weak, and therefore they often require potassium supplementation. And too much phosphates in the blood can lead to calcium being removed from their bones and making their bones weak. Lastly, the kidneys are also responsible for producing a hormone called erythropoietin, which stimulates the production of red blood cells. So cats with kidney failure are often anemic, and occasionally that anemia can become life-threatening. So just how common is CKD? And indeed, this is a very good question. We know that the problem is quite common, and it intends to increase with the age of the patient. But just how common is it? Now, this next slide on the left here, I've got my pointer here. On the left, this is how we used to sort of appreciate the condition by the development of azotemia. And on the right, we've got a study. It's an American study that was prepared by vets at North Carolina State University, and they were carrying out an investigation into degenerative joint disease. And what they did was to perform some additional diagnostic tests to assess the incidence of CKD in cats in various age groups, as illustrated along here. Now, the incidence of CKD in the older cats, the 10 to 14.9 and the 15 to 20 groups, was around that which I would have expected at sort of 42% and 80 odd percent, so quite high. But I was shocked when I watched this or looked at this study to see the values they were reporting in younger cats, the 0 to 4.9 and the 5 to 9.9s. It was a lot higher than I was expecting. Having said that, if I look at the situation here at Lawns with the staff's pets, we have 6 cats between us that are under the age of 10, and 2 of those have CKD, and one of those it is sadly quite serious. So it's certainly a problem in young cats, but whether or not it's quite as prevalent as suggested here is as yet unknown to me. But hopefully this new test will be able to shed some light on the situation. So this slide illustrates the current diagnostics that we use to detect kidney disease, or perhaps I should say the old ones. So this is what we're doing when we take blood. We measure BUN, or the toxic products that are produced by protein metabolism, and we also measure creatinine, and that's a product produced by muscle breakdown. We also look at urine. So we would look at your pet's urine to see how concentrated it is and to check for proteins in urine. And we can also measure the very small proteins, microalbuminuria, and that will increase in certain types of kidney disease. Unfortunately, all of those tests are relatively insensitive and tend not to show changes until quite late on in the disease process. Now, the gold standard, which I will just mention because it's on the slide, for detecting kidney function or assessing kidney function is glomerular filtration rate. And that is indeed very accurate, but for technical reasons, this isn't a test which can be performed in clinical practice. So this is a test which tends to be produced or performed in laboratory conditions. So following on from the last slide, here we're illustrating time along the bottom and along this axis, and we've got some kidney damage which has occurred at this point here. And what happens from this point obviously is the kidney function in red that deteriorates with time, and we can see that tailing off here. But if we look at the things which we're measuring in the blood, so the urine, the urine. So if we look at urine-specific gravity, we can see that actually remains quite normal for quite long periods of time after the kidney injury, and then it starts to decline quite late on. And the same applies with urea and creatinine. So this is the blood test that we do. We can see on this blue line that these toxins don't start to increase in the blood until quite late on in the disease process. So this is the area where we would currently be making the diagnosis, and you can see it's quite a long time after the original kidney problem started, and therefore a loss of kidney function has already been lost. So this is less than ideal. So in this slide, this is just talking about creatinine, which is the old kidney function test, and it says here that we're only really picking up once 75% of or up to 75% of kidney function has been lost. Also with creatinine, it's also influenced by factors other than kidney function. So, for example, these well-muscled animals, or in this case, this cat is quite a plump cat, they will have different creatinine values if they have the same kidney function as these animals in the bottom. Because creatinine being formed by the muscles, the more muscle you have, the more creatinine you tend to form. So that can sometimes make the interpretation of some of these test results rather more challenging. Now, if we look at this new kidney function test, and it's detecting a substance called SDMA, symmetric dimethyl arginine, and it's got three key attributes, which makes it particularly useful as a biomarker for kidney function. It tends to detect kidney disease earlier in creatinine, and it is also specific for kidney function, unlike creatinine, and it's not affected by factors like lean body mass. So what is SDMA? Well, SDMA, and first things, I guess I must apologise to any cats watching this. We have a picture of a dog here doing its thing, but unfortunately it's the only slide I could find. Essentially, SDMA is formed in cells when arginine, which is an amino acid, is metabolized, and it's methylated, and then it's excreted in the urine. So that's what SDMA is. That's what we're measuring, and hopefully this will allow us to pick up and make an earlier diagnosis. And we're hoping that we're going to pick up changes in the SDMA on average when 40% of kidney function has been lost, and possibly as early as 25% loss of kidney function. And I've just illustrated this, what this means in the practical sense with the kidneys in this next slide. I mean, when I'm palpating cats' kidneys, when they're older, often we'll feel these rough, knobbly kidneys, and often these kidneys are really quite diseased. They're old and they're scarred, and obviously at that stage, often a lot of kidney function has been lost. And with these younger cats, their kidneys will feel quite smooth, and with the old test, we probably wouldn't be aware that there's any disease process, where with the new SDMA, we're going to hopefully pick up this problem. So basically, we're looking to use this SDMA to detect the kidney disease, the presence of kidney disease, much sooner after the initial kidney injury has occurred. So just how much earlier are we able to detect kidney disease using SDMA test when compared to, say, the old creatinine test? Well, in cats, we anticipate picking up disease 17 months and maybe even up to 48 months earlier. So that's a very significant improvement. Not only will we pick the disease up earlier, we're also likely to make the diagnosis in a large number of cases, as illustrated here in this slide again from America, where 250,000 cats were tested, and CKD was diagnosed in 11% of cases when we're just looking at the creatinine. But when they looked at both creatinine and SDMA, they were picking up kidney failure in 26% of cases, so 2.4 times as many cases being detected compared with the old test. Now, if we look at age breakdown in this next slide, it gets even more interesting. In this slide, the light blue boxes at the top of these graphs, these are the cases which we would have picked up using the old creatinine test, and the red boxes beneath represent the cases that would be picked up using the new SDMA test. So you can see from cats aged from 6 through to 14, for every case, or roughly, this is a bit rough, but for every case that's being picked up with the old test, we're actually picking up 2 more cases with the new test. So really and truthfully, the old test was only really picking up about a third of our kidney function or our kidney problem cases. Obviously, that's far from ideal. Now, this next slide demonstrates something called the IRIS staging system, and IRIS stands for the International Renal Interest Society, and basically it's a group of veterinary surgeons, an international group of veterinary surgeons who've got together and they've divided kidney disease up into 4 stages. Stage 1 being mild disease, through obviously to stage 4 being severe disease, and you'll notice that the clinical symptoms, which the sort of things which as an owner you might pick up on, they only really become evident in stages 3 and 4. They get a bit of a mention in stage 2, but it does say here that they're usually mild or absent. So by the time you're actually noticing changes in your cat's behaviour, sadly it's often quite late. So what things? Oops, let's just go back a slide. What things might your cat do to try and attract your attention that maybe they've got a problem? Well, the main clinical symptoms associated with CKD are excessive drinking and excessive urination. So you might notice you're having to fill their water bowls and perhaps empty their litter trays more often. Though a lot of cats, I appreciate, they go outside and they urinate outside and they drink outside. So again, you may not have noticed these things. Other signs to monitor for your cat might include decreased appetite, often in combination with weight loss. And then we've got a whole host of other signs which are a little less specific, but certainly they do occur. But as I've said, by the time a cat is showing these signs, it's already a little later than ideal. So we said that clinical signs only tend to show up relatively late in the disease process, and that our current diagnostic tests have only enabled us to detect CKD at a late stage. This is where SDMA comes in. Hopefully, it's going to enable us to detect stage 2 cases and possibly even as early as stage 1. Also, if we look at the SDMA levels, the actual measurements, it may actually help with giving us an idea of what stage your cat's kidney disease is at. So if we're able to make an early diagnosis, what can we do about it? Well, there are quite a few things nowadays which we can do, and we might want to consider introducing a diet that supports kidney health, or possibly, if the disease is a little bit more advanced, a therapeutic diet. And there are varieties on the market in various formulations, sort of moist, wet foods, and then the dry foods. And this does actually make a difference. A study which was published, I think, way back, yes, back into 2000, and this was a study actually which was carried out by a lecturer of mine, an old lecturer of mine, Peter Markwell, and he was a lecturer when I was at the Royal Veterinary College. So I know, or did at one stage know him quite well. And what they illustrated was that cats fed a renal therapeutic diet survived 2.4 times as long as cats fed maintenance diet. So 633 days versus 264. And it wouldn't surprise me that if we can make an early diagnosis, and obviously back in 2000 we were diagnosing using the old tests, and that possibly these survival times, they might actually go up from there. And there've been a couple of other studies performed, looking at uremic crises and in both cats and dogs. And again, they've illustrated that the feeding of kidney darts versus maintenance darts, has made a significant difference in survival times and issues, uremic crises, which is where your pet suddenly deteriorates. So definitely some advantages to making that diagnosis and and instituting some early treatments such as dietary change. So we've made an early diagnosis and we've initiated a renal therapeutic diet. What other things might we might monitor with your cat's health? So we'll want to watch for changes in body weight, change in appetite and overall demeanour. We will want to do some blood tests from time to time to check for the development of anemia, for monitor changes to urea, creatinine, and SDMA levels, and also just keep an eye on those phosphate and electrolytes that we mentioned earlier. We might also again want to check the urine-specific gravity, so see how well your cat's able to concentrate the urine, and look at the sediment and perhaps do a dipstick analysis and measure some protein levels in the urine. And we might also want to keep a little eye on your cat's blood pressure, and we'll come on to that a little bit in more detail in just a moment. So when we're checking urine out, and doing an urinalysis, it's relatively straightforward to perform. We do dipstick tests, so little tests which we pour some urine onto a little dipstick, and there's some colour changes on some little squares on the dipstick, and that sort of tells us what's in the urine. And we might want to sort of just check out the urine-specific gravity, and then possibly have a look at the urine under the microscope and just see what's in there in terms of casts, crystals, and red and white blood cells. Yeah, and if we move on, just this next slide, this is looking at how we measure blood pressure. This is done using a Doppler probe and cuff system, and it's quite common for cats to suffer from hypertension, and one of the most common causes of hypertension in the cat is CKD, but it'll also be caused by overactivity of the thyroid, hypothyroidism, and some of them are what we call idiopathic, which is a fancy term for we don't actually know what is causing it. But it is quite important that we keep an eye on blood pressure in older cats. High blood pressure can lead to damage in other organs, so it is important that we try to control it. Now, I'm indebted to a gentleman, Dr. David Williams, an associate lecturer in veterinary ophthalmology at the University of Cambridge, for very kindly allowing me to use his images in the next couple of slides to demonstrate the effects of high blood pressure secondary to CKD. So in this first slide, we see this very pretty tortoiseshell cat with these big black eyes, and due to massive pupillary dilation. Sadly, this is not an uncommon presentation. These sorts of cats come to the surgery, and I get them out of the box, and as soon as I see these massive dilated pupils, I feel the worst, because it is highly likely that I'm going to find that they're blind when I examine their eyes in greater detail. Sometimes these cats have been presented to the surgery, or not been presented to the surgery for quite a few years. They're often in good condition, and owners are sadly often blissfully unaware that their cat has any problems. So they just suddenly start bumping into things, and it does come as a bit of a shock to the owner to realise that their cat was, unfortunately unwell, and they just didn't realise it. And if we have a look at the back of this cat's eyes, so this is looking at the retina. So this is what I look at when I pick up the ophthalmoscope off the wall, and we're looking at the back of the eye. We've got an optic nerve here, and blood vessels growing out, and we can see an area of hemorrhage. This sort of black, it's a red blotchy area here, and what can happen in fact this case isn't quite as dramatic as some, but the retinas can actually detach, and if we just go back to the original size, sometimes you can actually see these retinas, these sort of green membranes billowing forward. You can actually sometimes see them through the pupil without actually needing an ophthalmoscope. So very unfortunate, because once these retinas detach, there's not likely that they're going to regain their vision again. So important to try and prevent these problems. So we've talked about the diagnosis of CKD, and how in the early stages of CKD the problem can be managed by changes to diet. Unfortunately, in most cats, CKD is a progressive condition, and it will become necessary to introduce medications such as phosphate binding drugs, possibly some potassium supplementation, or appetite stimulation. And as the disease progresses, sometimes we'll need to give medications to try and stop proteins leaking out. So these last two, the cementa and the Forticor, help the kidneys work a little bit better and stop those proteins appearing in the urine. They reduce what we call the protein urea. Now, ultimately, CKD, as we said, it does worsen, and it often becomes necessary to administer subcutaneous fluids. For the vast majority of the time, cats are quite receptive to this relatively simple procedure, and owners in general find it quite easy to give fluids at home, typically 3 times a week, though in some cases they may benefit from more frequent administration. And what this does is it helps correct any dehydration, and it aids the removal of toxic products produced during protein metabolism from the body by producing basically a larger volume of urine. And it's essentially the closest thing we can get to kidney dialysis. It's not kidney dialysis, of course that works a little bit differently, but it's the sort of thing that with a bit of training, in fact, we've got some training videos on this on our website. It's something which we can show most owners how to do with their own cats, and again, it does make a big difference. Thanks for watching, and any feedback regarding this video will be very much appreciated.